So we are interviewing right now. We are going to ask, well, let me just let you take it away. And then I'll go in the end. We'll do
Okay.
that.
Hi, everyone. I'm Dr. Shirazian. I'm an OBGYN here in New York City, and I'm also the founder of Mommy Matters. You can find us at Because Mommy Matters, and we're really about making sure that every woman has accessible health information, understands her bodies, understands her choices, and that we really listen to women and make sure that we're giving them the kind of health information that helps them in their daily lives, helps them feel better, lead better lives, and that we're out there answering all of your questions. So I'm so excited to be here with the Kat Stickler.
I'm so excited. We've been trying to plan this for a long time, so I'm glad we finally got it down. Okay, here we go. These are moms asking, how am I able to tell after I've had my baby if I have postpartum blues or postpartum depression? Also, what is the difference?
Really, really good question. So postpartum blues are super common. The statistics for that are like 50 to 70% of women. And so basically after you deliver, there's this drop in your hormones, more or less, after delivery. And that drop of hormones makes you feel immediately really sad. And so we call it the blues because it makes you feel really sad. It makes you feel very emotional. Sometimes women cry a lot after delivery. They feel kind of overwhelmed, anxious, emotional. That's all part of the postpartum blues. And we say that postpartum blues are really those first 2 weeks after delivery where you feel really sad like that. And
Right.
if it extends beyond the first 2 weeks, and is lasting into week 3 and week 4, where you're still feeling sad and you're still feeling like you can't get out of bed and can't get motivated, there may be something else to that. There may be some postpartum depression.
Okay. I would have loved to know that when I was I didn't even know postpartum blues was a thing. I was like, it's either PPD or nothing. Like, that's what it is.
Right.
So,
And PPD is really 6 weeks. That's sort
okay.
of our defining medical time. But really, after 2 weeks, you should start to feel a little bit better. And if you don't, I think you should really pay a lot more attention to it. There may be something else there.
I love that answer. You're good. I forgot how good you were. Okay. Next question. Is medication the only way to treat postpartum depression?
No, it's definitely not. For some women, I think medication is really helpful. And you spoke so eloquently last time about how much it helped you. And it just reminds us that we should never be afraid of using medication because it really can help women tremendously at this time of intense pressure and need. But definitely you can try other things like trying to push yourself to get up and exercise, trying to
Right.
increase your support around you with the baby, making sure you're getting enough sleep. I think sleep is so key because sleep affects our mood, just overall. And I think it can make depression even worse. And it can make other sort of mental health issues after delivery even worse, like anxiety. So definitely sleep, exercise, eating well, and support from your family and friends are our first line of things to do and try. But we should not be afraid of medication because I think medication helps a lot of women get through a really tough time in their lives.
Yeah. I think that's, like I said in the last one, that was literally the only thing that made me feel like light at the end of the tunnel. You can do this. It's not the end of the world type of scenario. Yeah.
And that, honestly, that struck me so much when you said that, because I think we forget that it's such a vulnerable time. And sometimes women feel so isolated and so unable to kind of lift themselves out of that. And that was sort of what you were describing. Like sometimes we feel down and depressed, but we feel maybe a little bit like we can motivate and lift, and other times you cannot at all. And I think just hearing you say that, it reminds me so much that it's such a vulnerable time, and we really should not be afraid of starting medication. I mean, if you need it for a few months, if you need it for longer, why does it matter? It's really going to make your life better and allow you to live it. to its
Right.
fullest. So,
Well, that's a good segue into the next question. So, this person's asking, I had been on medication for about 9 months, and the reason I was scared to initially start it was because I didn't want to become addicted or dependent on it. Now it's time to go off, and I feel really uncomfortable. Do you have any tips on how to make this transition better, or should I simply stay on the medication? Like, you can only answer some of this because her doctor will answer the other stuff.
right. Well, Kat, what do you think about that actually? Because, I think a lot of women feel like this. This was actually something I was going to ask you. When you started it, did you feel uncertain about starting it at the beginning? Yeah.
Yeah, very uncertain. I think also I just wasn't educated on it. So I was like, it's gonna turn my baby into like hooked on this, and then my baby's gonna get sad if I'm breastfeeding, and then I stop taking it and she's relying on it. I didn't know anything about it. Yeah.
Right. And I think that's what she's saying her concern is, right? So that's really reassuring, that doesn't
Right.
happen.
Right. I did. I think I told you in the last one because I was public in saying that I was off my medication and then I had to get back on it. And that was discouraging. But then again, I've gotten so much better ever since I've become a mom to be just easy on myself. Like, it's
Yeah.
okay. It's really not the end of the world. Move on. You'll get better next time. So I think I'm also doing that transition and I'm nervous about it too. I don't know. I think what's really helped me is listening to my doctor, lowering dosage, and really just being hyper aware of what I'm doing with my mind and my body and really just, you know, not having a bad day because I haven't done anything all day. Having a bad day, like, is I don't even know what I'm trying to say. Okay, I know what I'm trying to say. When I started getting off the medication, I felt like my bad days were because I was lowering my dose. But in reality, I wasn't doing anything all day. I wasn't working out. I wasn't talking to friends. I wasn't doing the things that made me feel alive. So that was also the reason why. So when you're going off the medication, to really be cognizant that you're still keeping up with your lifestyle and your routine and things that make you feel good.
Right. Perfect. And I think what you just said is so important. You should never stop your medication cold turkey. So you shouldn't just stop it altogether, right? You should decrease the dose and sort of then take stock in how you feel. So if you are at a point where you feel like, I want to try coming off it, I want to transition, talk to your doctor, but just know that it will be a process. It'll be about kind of lowering the dose a little, seeing how you
Right.
feel on the lower dose, maybe lowering it a little bit more. But there's no harm or shame in being on medications for as long as you need them. And I think there's that stigma that we really need to disassociate with postpartum depression. It's really important. You can be a better mother if you feel good. So women should always think about taking care of themselves first. And I love what you said about caring for yourself, because that's central to really everything that we should think about in terms of women's health.
No, I totally agree. I think, well, I love how these are going because the next one segues into it as well. This woman said, I've been on medication for 5 months now, and my sex drive has completely gone away. My husband and I have not been intimate in a very long time, and I'm nervous about the effect and impact this is having on our marriage. I also don't want my daughter growing up and not seeing us be affectionate. I know that's in the long run, but what are your thoughts on this affecting a marriage?
Yeah, that's actually very tough because we do know that that being on the meds can drop the libido. And I think, thinking about, I think thinking about sexuality and how you want to be intimate with your partner is important. So there's the libido, but you also want to think about, do you feel uncomfortable? Does the vagina feel dry? There's sort of
Right.
lots of nuances to it. And there are things we can do for some of the other nuances, like if you feel really dry, because actually something that women don't talk about at all is the fact that after delivering a human being, the vagina loses its estrogen. So you naturally lose estrogen vaginally. And so women feel dry and they need the support of that vaginal estrogen to really make them feel better about being active. So it's not painful, so that it's comfortable, so that it's even pleasant sometimes. So, I think I would really take stock of what about it is uncomfortable, and maybe work on all the other aspects that you can, like the intimacy piece, feeling connected, vaginal
Right.
dryness, anything else that you can work on.
Oh, that's good. Okay. Next question. This is actually from a husband. He says, my wife just got diagnosed with postpartum depression, and I am feeling all kinds of guilt for thinking that she was just going crazy and not being appreciative of me and our new life together. What is some good advice for a husband taking care of his wife who is battling postpartum depression?
That's a really good question. I
That's
love
sweet.
partner questions. Go partners.
Great guy, man. That was
Whoever
good.
you are out there, go partners. I love it. Love it. So actually just recognizing right there that maybe you haven't been as supportive as you could have been is huge. And using that to turn around your level of support for your partner. That's what I would say. The way you can show her that you understand, that you care about her, is to give her that support. Honey, do you want to sleep the extra few hours? I will make sure the baby gets, a bottle or fed. Do you want to go and exercise today? Why don't you take an hour and go see your friends? I'm going to watch the baby. The things that you do that show that, you really care, that will show her that you support her, that you value her, that you love her, that you believe her, all of those things. And really, it's never too late to communicate, right? It's never too late to be candid. And it's never too late to say, I'm so sorry I didn't believe you, but I understand now and I'm here for you and I want to do better.
Oh, that's so good.
Right?
Love
Isn't
them.
that,
Love that. That's
so,
very sweet.
so lovely. Yeah.
Okay, next question. I know there were a lot, so I picked like the top 10 that I felt.
I love questions.
Okay, good.
Because
Good.
look,
That's
you
good then.
inspired everyone. Look how much you inspired everyone. Everyone's like, we want to ask you all of these are really, difficult and intimate questions. And I think it's just
Yeah.
great that people are
I'm so
willing.
happy that I have you to answer them and they feel like comfortable enough. Like we have a professional in the house, so we can ask away whatever we want. This next question is, I had severe postpartum depression with my first child and am now pregnant with my second. I managed to get off medication, but I'm nervous about experiencing postpartum depression again. Is it common once you have it, or is it different for every child, or is it genetic or hereditary?
Really good question. Really, really good. Um, I think it's great that you went to those, lengths to kind of get off the medication, and you're trying to, set yourself up for being off of it this time around. But there is a big element of recurrence with postpartum depression. It's like 20-25%. So honestly, I think as a physician, what I would recommend is thinking about going on a low dose of it, like right after delivery, just to support yourself. Because
Okay.
the reality is that, it often does recur. And so having that knowledge that maybe it could happen again, and supporting yourself so you can be as strong as possible, I
Right.
think is not a bad idea. If you really don't want to do that, then just be cognizant of it. And if you feel really sad and depressed this next time around, just make sure you know that you can restart it,
Right.
quickly. Yeah.
That's good. Next question. I got diagnosed with postpartum depression and I have been on medication for about 2 years now. We are trying to start another, oh no, we are trying to have another family member added in. And I'm wondering if I should still be on the medication if I'm trying to get pregnant. I wasn't on medication when I got pregnant the first time, and this is making me hesitant about getting pregnant for a second time.
Right. I had this question today actually in the office. And it's kind of, it's wonderful. Women are so cognizant of, protecting their fetuses when they get pregnant. And even when they're thinking about getting pregnant, about making sure that they're protecting, their unborn child. But really, women, ladies out there, I want you to think about yourself, first. And I want to rethink a little bit how we think about pregnancy, because a healthy mommy equals a healthy baby. So if you are at your best, your newborn, your infant, your fetus, they will be protected and they will be best supported. So what I always tell women is, if you need the medication, you can try and come down off of it if that's reasonable for you, if you feel good on a lower dose. And I think that is, that's typically what we recommend. But if you need that medication, you should be on that medication. Even if you're trying to get pregnant, even if you're in the first trimester of pregnancy, it doesn't matter. We truly need to support the mother, because you will have overall better pregnancy outcomes.
I think that's crazy you said that, because I thought about that too, honestly. And it did not occur to me, not even once, to think about, if I'm good, the baby will be good. Like, not even once was that. I was like, wow, that
I
sounds so
know.
obvious, but
It's tragic. I
crazy.
mean, really, it kind of, that's why actually our whole platform, honestly, of at Because Mommy Matters, because people don't think about mom first, at least not that often. And even moms, they're thinking about the new baby, which I understand. I'm a mother. I have 2 kids. So, I totally get it. But we want each woman to feel like she's important and valued, because when mom is supported and feels good, everyone is good. I mean, it's really true. It's
True.
it is really the truth. If you are functioning at your best, your baby, your child, they're going to be at their best.
Yeah.
And so, yeah.
Even your business though, and so you can explain the, I mean, this is the panties were,
Yeah.
I put them on and I'm not even like postpartum, like technically, I mean, I was wearing diapers after I gave birth, and I felt it was so uncomfortable, and I hated getting out of bed like next to my husband, because I was wearing this like saggy big diaper, and I was already having like these body images of like my body's changing but trying to come back and it hurts. And I put yours on and they're cute. They have this cute little, I mean, you just feel not like you just had a baby, and it just makes you feel more like yourself. And it sounds so small, but it made such a huge difference. It was like so
It
surreal that
honestly,
something
it
like that.
does. I have one here. When I first developed the underwear, it's funny, I talked to the medical board about it. And this is the package, the new packaging. We have new branding, which is super cute. But I
Wow.
talked to my medical board about the underwear, right? And this
Yeah,
is the
that is, I would
underwear.
buy that, like that's a cute swimsuit, cute bottoms, so cute.
And it has this cooling pad. So if you are postpartum, you can cool, we call it the perineum, the rest of the world calls it what? The crotch or the vagina. But but all those little tiny tears and all that discomfort in the vagina, this is going to cool it down. And we actually are coming out with a spray that also will make the whole area feel comfortable. But funny story, when I first showed this to our medical board, right, because we have a medical board at Mommy Matters, they were like, that's like sexy underwear. And I'm like, yeah, so what? Right. And they're like, well, but the mom's postpartum. And I'm like, yeah, but she's still a woman and she still wants to feel like a woman. It's true, she's postpartum. Maybe, she's not probably sexually active, right, in that first, depending on the person, 6 weeks to maybe even a few months. But, she's still a woman. And this means that we value her and we think that she deserves better than a diaper after she birthed a human being, right? So there is importance to the products that we give women too, because it shows a certain level of value for what they've been through, gone through, what they need, who they are, and their health. And so, yeah, so that's why I feel so strongly about underwear.
No, it's amazing. And it's amazing that you made this too. Like, that's such also boss woman thing. Like, you're not just a doctor. You're like, I'm going to invent this underwear for after you give birth. I'm just going to take care of you every step of the way. It's all good. I love it.
Well,
So
did I
nice.
tell you, as an OBGYN, at my delivery, I forgot to steal those, basically women just grab those underwear off the
Oh
labor
yeah,
floor
you
a
stock
little.
up on those.
You just stock up on these like horrible underwear. I mean, they really probably cost 1 cent to
I
make
know,
them,
they're
or
so
10
bad.
cents. They're so bad. And so I forgot to grab a handful because like I was in pain. I had a baby,
Right.
I wasn't thinking about that. And I got home and I could not find any underwear. Like I couldn't buy it from anywhere. Like it was very hard
Oh,
to find something else. So
so you made it.
yeah, we got to make
You
what we
solved
can
your problem.
find.
I love it. Oh my gosh. Wow. Okay, so next question. I had a feeling I was experiencing postpartum depression, but when I Google searched it, it said that I would feel like I wasn't connected to my child or disdain towards my child. Since I did not feel that, I assumed I did not have it. But then I was diagnosed with it 3 months later. Can you clarify on what this means or if it's a different type of depression? Thank you.
Right. So that's actually a really, really important point. I personally think that Googling things are a big problem. Again, why we want to kind of keep all this great health information on one platform for women. But so postpartum depression takes a number of different attributes depending on who you are and how you're feeling. So there's a whole bunch of things that women experience, and all women don't experience every single one of the characteristics, right? So you might feel really sad, really depressed or down. You might feel like you can't go outside, you can't do any activities or even get out of bed. You might feel like you can't sleep or you can't eat. You might start losing weight. You might not be able to care for your child, but you probably actually don't necessarily feel disdain. I think disdain is probably not a right characteristic. It's more like you don't feel a connection, right? You don't feel like you can take care of that other person, or that you have the ability to kind of motivate and get yourself to do the things that you might want to do in your head. So I think there's like this disconnect between mind body, and it really makes women feel really isolated and alone.
Yeah.
So I don't know that I would ever use the word disdain, but I guess somewhere on Google they used it. But I think the point is that not every woman feels the same way.
Okay.
And you might feel some of the characteristics, but not all of them. So again, it's like that individual attention to each woman. So if you're not feeling right, and I'll just say it like that, if you feel like something is really wrong, I would talk to your doctor, or, look at a valued health resource to really see
Okay.
if
Yeah.
you're feeling
Even when I remember, thank you. I remember researching PPD as well. And I remember reading something on Google and it was like, because your child is getting attention, you don't like that and you start disconnecting, like you said. But then it was like random, like, I mean, I think it was like on a Reddit thing, but when you're going through it, you're like absorbing everything you can because you've never heard of it at all. So I didn't know that though. That was cool that you clarified that. I think that's super important because I feel like that adds to the embarrassment of saying I have PPD, and then people have asked me like, "Oh wait, does this mean like you don't like your kid?" No, that's not what that means.
that
So,
doesn't mean, I can't even believe that's out there, to tell you the
oh
truth.
yeah,
Like
yeah,
I
it's out
was
there.
not even aware that people are even saying that.
Yeah,
That honestly, to me, that's so wrong, because that is implying that like you don't care about your child, which is not at
right.
all what postpartum depression is. Postpartum depression is a clinical, condition where
Yeah,
you really don't have control. I mean, I think depending on like the blues in the beginning, you can kind of try and come out of that as the hormones improve. But once you're in true depression, you really don't have control. That is really, I
Yeah.
think, the biggest piece of it. You don't feel like yourself and you're not in
Mm-mm.
control. There is that
Mm-mm.
disconnect.
Yeah. I know when I felt it, I loved her a ton. And maybe there was guilt because I felt like I couldn't love her as good as I wanted to because I was struggling to like love myself. But there was, yeah, never anything of that. So I'm glad we cleared that up. Okay, next question. I have struggled with addiction for the better half of my life and have overcome it and have been sober for 5 years. I am pregnant and am having a baby, and I am assuming that I will be diagnosed with PPD. Should I take medication? Is it addictive? I do not know what the right decision is. PPD runs in my family.
Got it. Got it. Well, unlike the category where if you've had depression before, you are at risk of having it again. Addiction in and of itself is not necessarily an indicator for postpartum depression. Depression is, so if you've had depression at another point in your life, or you've had a mental health condition or disorder, then yes, that can set you up for postpartum depression. And if that's what this person is asking, then I think it sometimes it does make sense, like I said before, to start a low dose of an antidepressant right at delivery, because I think it really does help a lot of women. But yeah, I don't think that addiction in and of itself is a setup for it. So if you've never had a mental health specific condition, even if with the family history, it does not necessarily mean that you would have it. So I think I would just be really cognizant of it in this case. And if you start to feel these symptoms and you start to feel like they're not normal, talk to your doctor and then consider getting on a med.
Okay. Next question. This is the last one I have, or I can do more, but this is like a wholesome one I wanted to end with. My best friend just had a baby and has been MIA for a few months now. I understand that bringing a new child into your life is a big experience, but we have never gone this long without talking, and I do not know how to approach her or if I should drop food off at her house or not. I don't want to overstep my bounds, and I'm also worried she might be experiencing postpartum depression. Her husband is on military leave. Do you have any good tips on how to help her out?
Oh yes, I definitely do. But I
Do
want
I
you to
ever?
answer that one too, because you probably have really great tips having just,
Yeah.
gone through it. So so I would say, go knocking on her door.
Oh,
I'm
yeah.
really I'm all about that, right? I would say, yeah, maybe and I think people feel like they're overstepping bounds, right? And maybe they don't know what to say or what to do if they discover that
Mhm.
she does have postpartum depression, right? But
Right.
I think just your presence is amazing.
Mhm.
So knocking on the door is, just a great thing, and saying, how are you? Do you need
Yeah.
anything? What can I do for you? Like, I'm
Right.
here. And again, always being honest, right? Like, saying, I'm sorry if I'm being annoying. I just wanted to stop by and see if I can help in any way. People love that, I think. But
Oh,
what do
I
you
did.
think? What if someone came
No, I
knocking on
did.
your door?
I loved it. I absolutely loved it. And I loved how, because sometimes I didn't want to see anyone. And I loved how they would be like, hey, I just left you something at your door. Don't come out and see me. I just want you to have this. It made me feel so special. And then friends that were like not resentful or upset for me not communicating with them, but came and saw me like nothing changed. Like it was all fine, was so appreciated because I did feel guilty. I'm like, oh, I feel bad. But that was very nice. But yeah, like you said, just showing up really made the best impact on me when I was going through that.
And how great is that? I mean, so much like love and support that your friends, just drop it off on your doorstep and say, just wanted to say hi. I mean, I love
Yeah.
that. It's great.
That was probably my favorite because in the beginning it was definitely blues and I would just sob uncontrollably. My mother-in-law and my mom thought I was losing my mind. I'm like, I don't know what's wrong. But that's what I needed in those first like couple weeks, especially. That was very much needed, and it fed me, and it was great. It was food.
Yeah. And the blues, I think the blues is really, a lot of women have blues. I mean, numbers wise, like the majority of women have those postpartum blues in the first 2 weeks. So that's really common. And so women should expect to feel like overwhelmed and anxious and like they're
Mm,
sad and crying, and just make sure that they talk about it with their loved ones, talk about it with their doctors, and like kind of pay attention to it as the weeks go by. I think that's probably the biggest thing.
I think I'm so surprised that this isn't vocalized in your checkups. Like, I never had heard of that being common. I've heard of it existing. I'd never heard it could happen to me. Basically, I was like, "Oh, that happens to other women. I'm in the clear." So I just can't believe that all the time I showed up for my checkups, I'd never even been informed that that could happen to me.
Right. I think, the problem is that like so many things happen, like in
Right.
pregnancy and postpartum. It's like it's all
Yeah.
new. It's all kind of just a crazy haze, have a delivery and then you're not sleeping, you're having a baby, you have to think about breastfeeding this baby. How are you going to do that? I mean, there's so many competing issues, right, at delivery that I
Right.
think women forget and realize that that's like part of it. And I think the other thing is, it's sort of this permission to,
Mm,
maybe understand that you will not be in. And I think that like these two things kind of, what I want to say is they kind of fight each other a little times. As women, we want to have a plan. We
mhm.
want to, think about like the birth plan. A lot of women come and they have this birth plan and how they want things to go. And it's very disruptive when things don't go according to plan.
Right.
Um, and so I think that can be really hard to cope with after delivery.
No, that's a good point. And I also want to add, for me, one of the keys, I think, in me just letting my OB know was the nurses were super aware of my demeanor from when I was, like, "Hey guys, like I'm bigger, like I'm pregnant," to when I showed up for my like 4-week follow-up, 6-week follow-up, and how I just a totally different person. And they like told my OB, and that made her start the conversation and ask me if everything was okay. And I just busted out in tears, and I was totally fine when I saw her. I was like, "Hey," like just putting on a smile like everything was fine. But right when she asked me, I just my mom, I remember, was sitting next to me, and I looked over at her, and she's like, "It's okay." And then I just let it all out. And so that was also super helpful. Just a staff that was super aware and knew the patients and said something and like spoke up, which was good for me.
That's really amazing. I think, you're such a great spokesperson for it. And I said this before, but, you are like the opposite of what people think about when they think about postpartum depression, And I think it just really, because you're bubbly, you're fun, you're lovely. It's like, it's that happiness that I think there's this myth that postpartum depression can affect all of us,
Right.
and of course it can. It has nothing to do with that, and it really is something that's out of our control. And so recognizing it and making sure that we pay attention to it and get the help and treatment we need and get the support we need is just the key piece.
I agree.
um,
And I think it's humbling for me because I was one of those women, unfortunately, that would hear about this and in the back of my mind think, that's not true. Like, just, it's hard, push yourself, you can do it. Like, I've gone through hard ruts. But when you're actually in it, it's the most bizarre, surreal, helpless feeling. And I remember telling you this. It was like I didn't want to, like, even saying it, I feel like embarrassed to say, like, I didn't want to kill myself, but I didn't want to live. Like, I just really, and I'd never felt that way in my life. And just, it was just such a I don't know, I felt so guilty for even judging anything back there and thinking less than. And when I experienced it, it was, it's like a hole you can't get out of it. I can't even describe it. And I've always like recognized myself as mentally strong. Like, I got this. I'm gonna set my mind to it. But when that hit, it was just, I don't know. I just wanted to add in this. It's not a sign of weakness because I think that was actually my big thing. Not that it was bad for the baby, because I read about that, but that it was just like, I don't know, for some reason, like a sign of weakness. Like I didn't fulfill my duties of just having the baby normally. Like I had to have depression after just having
I
the baby.
mean, there's just like, there's so much pressures on, like pregnant women. I mean, to even really be thinking about that, right? To think like this is somehow my fault, or, I'm not strong enough, or I did something wrong, or all those things that they're saying on Google, which is just crazy to me, that like you don't care about your child. I mean, I don't even, honestly, I have no idea where that comes from. That is really troubling. So, it is none of those things. And I think as women, there are so many pressures. Like when you think about a delivery, right? Every woman is thinking about like, how am I going to breastfeed this infant, for example, right? That's like, it's really hard to breastfeed.
Horrible. So hard. It was the worst.
That's like a whole other story, right? But like, it's really hard. And there's this idea out there, and I just use this as another example, but like, there's this idea that like, if you don't breastfeed your child, like you're not doing a good job, you're not giving that infant like all of, and even in the medical establishment, I mean, they push you, like here's your lactation consultant, here is
Right.
what you should be doing. And I mean, I can
Right.
tell you as a woman who was trying to breastfeed, it was really hard.
I
And
didn't know it
there's,
would be so hard. I just thought it would just be natural. Just come on out. No.
and you hear all these stories, like my favorite is people would tell you their stories, and for me as an OBGYN, the other OBGYNs would tell me their stories. Yeah, I just turn on the shower and then I'm like just dripping milk. I'm just lactating. I'm like, really? Because that's insane. Because does that actually happen? But and it's just another example, right? So we put all
Yeah.
these pressures. We're supposed to have these beautiful deliveries, beautiful babies, everything goes perfectly. We're supposed to naturally be able to breastfeed, not have any problems after delivery, feel great,
Right.
feel happy.
Right.
I don't know. I don't know what else we're supposed to do, but like these are just constructs, and it doesn't happen for anyone like that.
Well, there's a
So
funny TikTok voice thing, and it's like a sound, and it's a mom saying like just these stigmas that society has, like, and make sure you breastfeed, but don't do it in public. That's disgusting. And like, and go
right.
back to work, but not too soon, or else you're not a good mom. But like, don't let them know, and just like all these things you're balancing. And it was so funny to hear it. But I think there's something super profound about even just being able to talk about it and feel understood, and like your emotions are valid. Because I think once they're validated, it's like, okay, like now I know this is a problem, meaning I can fix it. It's not like something that's in my head.
Right,
Yeah.
100%. And the other big one is you are not alone as you think you are not alone. There are many, 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 many people going through the same exact thing. And I think that's also super important for women to realize. Like it seems like it's the, end of the world. It's the worst thing that could happen, but it's not. And you will get through it, and you are not alone. And there is support out there. So, we want women to reach out.
So true. This was such a good conversation.
I always
Oh
like
my
talking to
God.
you. We need to think
I
of some
love
new,
talking to you.
more health topics. We can talk about
Yes, we should do a
postpartum.
new one each month or something.
Yeah, because we can talk about postpartum. We can talk about contraception. I mean, you name it.
Oh. Wait, I did see a question on here about that. Hold on, before we go. This will be the last bonus question, and then we are done. I
Okay.
know I'm taking up your time, but
I like
last
contraception.
question. Okay. I am on medication. I am on 20 milligrams of Prozac, but I also want to get on birth control. But my doctor told me that antidepressants sometimes don't let birth control work. What do you recommend?
Yeah, but we still recommend them. I mean, so if you don't want to get pregnant and you want that control over your fertility, which I love that we have, I do a lot of
Mhm.
global work as well. And many women around the world, they don't get the same kinds of opportunities to control
Right.
their fertility. So I think it's a huge thing. So Prozac may slightly, and we're talking about slightly lower the effectiveness of contraception, but that doesn't mean it's not effective. It means it goes from being like 98%, 90, like 97, 98% effective, like a few percent less, right? So we don't have an exact number of how much, but it lowers it very little. So what I would say is, yes, it's a good idea. The most effective form of contraception, especially if you're not thinking about a baby soon, is the IUD, because it doesn't rely on
Like in
you
here?
to do anything. Or
Like
the
this?
next one on is good too. Yes.
Okay.
Any of the LARC methods, the long acting reversible contraceptives. So those are the rod and the IUD. Because they don't rely on you to do anything. That's what makes them more effective. Like they can do their thing and they don't rely on you remembering them every day, right? So that's why they're more effective. But even a pill is a great choice. And any contraception is better than no contraception. So there's that.
Yeah.
So I would say that does not mean you should in any way stop or reduce your
Okay.
antidepressant. Just know it may slightly lower it.
Okay.
Yeah.
Is there anything else you wanted to add before anything you wanted to go over?
No, I just,
We went
I
over a
don't,
lot.
we did a lot. Actually, those questions were amazing because they covered like pretty much all of it.
Yeah. And a lot of the other questions were the same ones, just different people with different little details, but the same premise, a lot of them.
And I like that, a lot of it just kind of hits home the fact that it's really good that we're talking about this because women feel really anxious about all of these issues, and
Yeah.
concerned about what to do and how it affects them and how it affects their infants and babies. And so I think it's really good. We need to restructure how we think about postpartum depression. I think that's the
So
biggest thing.
true.
Yeah.
I mean, I can't believe that I just learned from you that it's not that you basically don't like your child. I really thought that's what severe postpartum depression was. Like, I didn't, like, when you said that it wasn't, my mind was like, what?
It's not an
So,
aversion to your child. Depression is really about you, right? It's about like feeling that complete loss of any kind, you're void of like happiness and inclination to do anything. I mean, people describe it in many ways. And actually I like how you described it because you said it was like a hole that you were kind of like stuck in. And I think that that's a really good way to think about it. It's about feeling isolated by yourself and powerless, right? That's sort of how I interpret that. But, you can speak better to that. But it's really not so much about your baby. I don't really
yeah,
know where that comes from.
yeah.
There's
And that's
another
again going on a tier. Like you said, it's like whatever, if you're good, then the baby will be good, but focus on you first.
100%.
Yeah.
And again, I tell women that every day, not only for like the antidepressants but for all of the other things, because a lot of women, when you think about it, they come into pregnancy with some health issues, like they might have high blood
Oh,
pressure,
yeah.
diabetes, and they want to stop all their medications. And I have to tell them that's not a good idea. You have high blood pressure, it's worse for you to stop your medications. You need to be on these
Wow.
medications. And even when there is some small risk, right? It's like everything else in life. There's a small risk, but there's a much bigger benefit to being
Right.
on. So that's what we have to think about.
That's so true. I love that. I'm so glad we're talking about this. I feel like I'm a doctor too. I mean, I know I'm not, but I feel so official
Yeah.
talking with you.
But you're the expert, right? Because you have gone through it. And so you are the expert, and women want to, they want to know what it feels like. And I think the ways you describe it really helps people understand.
Yeah.
And how did
And I'm
you feel?
super about that.
How did you feel about your infant in that time? Because I don't want to misspeak. Like, did you feel
Oh, I didn't feel that at all, like
okay?
at all. But I did feel um, sometimes I would look at her and be like, this is the end of my freedom. Like, I'd be like, I can't just go travel. I can't, like, I'm not going to be able to go on dates with different people. Like, I'm stuck here and my life is now your life and I will live to make you happy. So I think there was that more like looking at her like, wait a minute, what? Because I was so focused on giving birth and going through with the 9 months pregnancy, going through all that. I think that's what I experienced. And when I read that online, I was like, oh, that's what that is, but it's not as bad. But I never felt like I loved her any less. I never felt like I didn't like her, but I did feel sad sometimes when I looked at her and I was reminded that, like, because in my head, though, I thought I was going to feel that way forever. I thought that's what it felt like. I didn't think it would go away. I thought it was just, this is how you feel now, and this is a mom. So that's how I felt, but
Yeah.
never anything
I mean,
like less love
it
to
goes to
her.
show that it's like it is very complicated. People feel different things, but I probably just wouldn't start with that disdain
Yeah,
concept. But yeah, I mean, everything that the infant represents, clearly you're going to feel, right? So
right.
I think that makes sense to me because those are all the
Yeah,
things that she represents. And again, you're feeling kind of lost and isolated and uncertain about what this all is. So
right.
I think that makes sense. Yeah.
And I haven't said that out loud because I was embarrassed that I felt that way. Like I felt bad. And I even did a video on TikTok of me, like I was having a bad day and there was a trend, like a crying trend. And I was like, I'm just gonna film myself like literally crying because people ask me all the time, they're like, how are you so happy all the time? And how do you do that? Like I'm not happy all the time. And on the days I am happy, like I work so hard to be happy because you have to learn how to be who you are with a kid now. Like you kind of had it down on your own without that, but now you have to do it and there's another person there too. So I don't know, I think it's so important. I think it helps with the solution more than anything else and helps people feel better.
And it's a tremendous amount of pressure, really. Like, you have to be happy. You have to also be happy for that other person, right? I mean, you have
Right,
to make things sort of happy for that other person. You never had to do that
right.
before.
Mm-mm.
And that's a huge responsibility. I mean, literally millions of parents across the globe are trying to figure out in COVID how to make their kids happy. I mean, it's not easy, right?
No,
So I think that there's always that sense of like, gosh, this is so hard. Like, but I think it's more the powerlessness of the PPD. That's sort of how I think about it. I think of it as that
mhm,
powerlessness, but I guess there are those mixed feelings, obviously. And there's also, there is another kind of side thing off of that where women actually feel angry and even like it's a psychosis, but that does not happen very frequently. That's like 1%
right.
of women. So,
Yeah. And I think also it's important, my pregnancy was not planned and my whole everything was just not planned. And because of that, I thought that's what I was experiencing. I was like, well, if I would have done it the right way and dated this person for a certain amount of time and got married and then had a baby, then I wouldn't feel like this. So that was another big one for anyone experiencing that. Um, I don't know. I think I literally just thought of that, but yeah, that's what I thought. I thought that it was my
that's
situation, not
huge.
hormones. Yeah.
Right. That like this, I hadn't, prepared because again, women like to feel in control. Like, how did I prepare for this? What didn't I prepare for that I should have?
Right.
But we talked about this, like age is also a risk factor for PPD. So like the younger you are at your first delivery, more likely you'll experience it. It is a risk factor. So
Oh, right. We did.
yeah.
That's huge. I remember being in shock to that too. Yeah. Wow. Well, Dr. Shirazian, I had a great this was so good. I mean,
Thank
this was
you.
so good. I